Welcome everyone. As you are coming into the room, please feel free to enter your name and organization into the chat. We are going to go ahead and get started. So, on behalf of the American Cancer Society and the National HPV Vaccination Roundtable, thank you so much for joining us today for Session 4, Provider Education for On-Time HPV Vaccination. Now, as you again are entering the room, please feel free to enter your name and organization in the chat just so we know who is joining us today. Next slide. Now, my name is Brianna Sally, and I'm a program manager of knowledge translation here with the American Cancer Society and organizer of this learning opportunity. Now, for those of you that may be a little bit new to this space, this series is being held in partnership with the National HPV Vaccination Roundtable to convene our primary care providers and public health professionals to share promising practices that protect against HPV and related cancers. So we really appreciate each of you for being here with us today. Next slide. Now, just to lay some expectations for housekeeping, please know that this meeting is being recorded and the slide deck and recording will be shared in a follow-up email after the meeting. So you are more than welcome to add any questions that you may have to the Q&A box throughout the session, and feel free to use the chat to leave any comments and praise for today's speakers. And lastly, closed captioning is available. Next slide. Now, today's agenda is as follows. After our welcome, you will hear case study presentations from Dr. Lynn News with Atrium Health Levine's Children's on clinical education for HPV vaccination, followed by two representatives from St. Jude's Children's Research Hospital by Samantha Wells and Julia Brown on advancing HPV vaccination through provider education and other best practices. We really look forward to engaging with you as our audience in our live Q&A before closing out for the day with our resources, other educational opportunities, and more. Next slide. Now, this session will cover the following learning objectives: discuss how to implement evidence-based strategies for on-time vaccination, effective provider-patient communication, approaches to vaccine hesitancy, quality improvement, and cervical cancer elimination, summarize how to address barriers to HPV vaccination, including parental vaccine hesitancy, concerns about the efficacy, safety, and clinical workflows, and describe how to promote collaboration between healthcare providers, public health practitioners, and community organizations. Next slide. Now, as a reminder, this session is eligible for one live CME, CNE, or CE credit. Details on how to earn credit can be found in the CME or CNE document in the chat. Now, as a live participant, you must complete the SurveyMonkey evaluation that will be shared at the end of the session to receive credit. So please be sure to stay on until the very last slide after the thank you slide to get access to this evaluation. Next slide. But first, please participate in our pre-session poll and let us know which statement about the timing of routine HPV vaccination is correct. Test your knowledge and let's see. And based on the responses so far, it looks like there's plenty of people in here who may be future presenters on some future promising practices sessions. Looks like everyone is answering correctly. All right, so we are at about 73%. I'll give you a few more seconds just to for anyone else who has yet to respond to go ahead and drop that answer in there. Which statement about the timing of routine HPV vaccination is correct? All right, thank you so much for participating. Kayla, we can go ahead and close out that poll. All right, next slide. Thank you so much for participating in that pre-session poll. And again, do stay tuned until the very end to participate in the post-session poll. Now, studies do show that recommendations matter, and a provider recommendation is the #1 reason that parents decide to vaccinate their child. Now, today, we are going to be showcasing what that looks like for HPV vaccination. And I will start by introducing our first presenter. Next slide. So I would like to welcome Dr. Lynn News, who is the Senior Medical Director for Primary Care Pediatrics at Atrium Health Levine's, again on clinical education for HPV vaccination. If you have any questions for Dr. News throughout the presentation, feel free to drop those into the Q&A box. Take it away, Dr. News.
Thank you so much, Brianna, and thank you everyone for attending the session and giving me this opportunity to share with you today. We can go on to the next slide. As Brianna said, I am the Senior Medical Director for Primary Care Pediatrics with Atrium Health Levine Children's here in the greater Charlotte area. We have had a lot of focus on HPV vaccination across our 250 plus clinicians in pediatrics alone, but also then on top of that, partnered with our family medicine practices. Next slide. You may have heard that Atrium Health has been combining with other healthcare systems. And so Atrium Health Levine Children's is part of the larger Advocate Health organization, which encompasses clinics and facilities in 6 different states at this point. You can, just to give you an idea of the scope of all of our children's services at Advocate Health, we have Aurora Children's in Wisconsin, Advocate Children's in Illinois, and Atrium Health Levine Children's lives throughout the Carolinas, Georgia, and Alabama. We are altogether 127 pediatric primary care practices. We have more than 1.1 million pediatric primary care visits annually. Our geographic footprint represents about 5% of the nation's population under the age of 18, and 1.5% of all the nation's babies are born at an Advocate Health facility across our geography. Next slide. So you may look at that past slide and say, "Oh my gosh, that's such a big area, big network, and our clinic size or our network size isn't anywhere near that." But the fact is, the starting point when we're talking about how to improve HPV vaccination uptake is the same regardless of size. And so the starting point is always understand your current state. When is HPV vaccine being recommended or offered by your physicians and APPs? What's the current baseline rate of vaccine uptake? What kind of patient education is available and being reliably shared with families? One that, has come as a little bit of a surprise to me individually as a leader is there's a wide range of clinician attitudes about HPV vaccines. And so understanding where your clinicians are in their journey with HPV vaccine and knowledge and communication around it is important. And what is your staff's knowledge of HPV vaccine? I don't know about at your clinics, but what routinely happens with us is as the parents being roomed, they're asking what their child is due for that day. They'll ask our MAs what their opinion of individual vaccines are, especially around HPV vaccine. And if it was their child, would they give the vaccine? So the staff is an important part of the messaging as well. Next slide. And once you know what current state is, then what is the plan and where are you going? So you have to create the strategy and goals. It's important to involve all members of the team in that creation so that all viewpoints and experiences are represented. We want to definitely identify and address specific opportunities for improvement and care gap closure. And this generally falls into about 3 categories. So knowing your current panel of eligible patients in both dose who are due for dose 1 and for dose 2, working those lapsed well child visit reports if you can get those, Because if we can get them through the door for their well child visit, then we can have those conversations. And then the other opportunity is one that we honestly still struggle with, which is turning every visit into an immunization visit and being able to identify and have time to discuss the opportunity for vaccines that are due, including HPV vaccination, kind of regardless of what reason they are there for that particular visit. Once you know your baseline, your strategy and goals, and addressing those specific opportunities for improvement, then it's time to select tools specifically for education, not just of physicians and APPs, but also for your staff and for parents. And there are tons of evidence-based resources out there. Multiple toolkits are available through various reliable resources. And so having a structured toolkit to help drive your education and your efforts forward just makes the work a lot easier. And finally, creating some monthly reporting mechanism and sharing that performance data. For us, that's fairly easy. It's kind of just what we do every day as part of our infrastructure. But we are all facing vaccine hesitancy in increasing rates. And as part of the work that we've done, we know that vaccine hesitancy lots of times is not the reason that parents willing to get their child vaccinated aren't following through on that. There are a lot of workflow opportunities and adjustments and targeted outreach that can be done. And so, in the vein of controlling what we can control, it's important to really know your data, report it regularly, and identify those other opportunities. Next slide. Throughout our experience, we have really found the two evidence-based strategies listed here to be the most effective at driving the messaging. And you're going to continue to hear this throughout the presentations. But back in 2020, we partnered with the American Cancer Society in a maintenance of certification program that really focused on the announcement approach as the evidence-based strategy to drive improvement. And we were able to improve our HPV vaccination rates by about 10 percentage points through that. The strategy is simple. You want to announce your child is due for their HPV vaccine today. If it's at a visit where they're also getting their tetanus and their meningitis, bury it in the middle of that message. Your child is due for their tetanus, their HPV cancer prevention vaccine, and their meningitis shot today. We know, again, there's a lot of vaccine hesitancy. We have a lot of questions. Some parents have never even heard of the HPV vaccine. And so it's important to really connect and counsel the patients, the parents on their own individual reason for pause. And so if that parent seems hesitant, call it out and say, what is your main concern about the vaccine today? And then proceed to direct messaging with clear facts behind your answer that really addresses their main concern. And you know what? Reiterate your vaccine recommendation at the end of that so that they hear that their primary care provider is still continuing to recommend the vaccine. Try again. You know, the old saying, if at first you don't succeed, try again. We know that almost 70% of parents who initially decline will later agree to HPV vaccination. And so that fact alone really helps drive the importance of the next evidence-based strategy, which is starting conversations at age 9. When we introduce the HPV vaccine at the 9-year-old well visit, we are creating not just an opportunity for conversation, but for an opportunity to let the parent potentially refuse so that they can have their concerns addressed, and then more opportunities to get the child vaccinated fully and completely by the age of 13. Um, Parents will go home, they'll research. Having trusted kind of recommendations for places where they can research is also important at this point, so that they're not searching across the internet and getting less than factual information. And finally, reinforcing the message that the immune system responds more completely, more robustly at younger ages, and therefore risk reduction and prevention of future possible cancers is much greater. Next slide. Oops, back one. There we go. So we have great evidence-based messages that will help address parent concerns. And this infographic, I think, sums it up incredibly well, all in one place. And you can see the link at the bottom takes you directly to the source for this flyer. But it gives us answers for questions about age and why we're vaccinating so young, about, sexual activity and does this increase sexual activity, and responding that this is about cancer prevention, answers about safety of the vaccine, effectiveness of the vaccine, guidelines and recommendations by the American Academy of Pediatrics, the role of cancer prevention from the HPV vaccine in males in particular, and the I'm going to say slight disconnect that we as a society have between what's required for school and what is medically recommended for children related to vaccines, and how to help bridge and educate families on the difference between that. Next slide. I think the most prominent message that we can give to our patients, if I had to pick one thing, is the importance of cancer prevention. More than 13 million people, including teens, are infected with HPV annually. We have 6 strains that have, or 6 types of cancer, 9 strains in the vaccine, that we can actually reduce the risk of and prevent more than 90% of those HPV related cancers. Since the release of the vaccine in the United States, infections with cancer causing forms of HPV and cases of genital warts have dropped 88% in teenage girls. And we all know we have more data on girls over a longer span because the initial indication was only for cervical cancer prevention. And hopefully we'll see similar drops in males as we get a longer history of vaccinating our males behind us. Protection against those 9 HPV types and the 6 cancers is long lasting, with no signs of waning immunity over time. Each year, more than 40,000 new cases of cancer caused by HPV are diagnosed in the United States, with about 7,000 to 8,000 deaths per year. And finally, we know that countries with high HPV vaccination rates, close to or above 90%, like Australia, Bhutan, Rwanda, and Scotland, are really on track to significantly decrease or even completely eliminate cervical cancer. And we have several countries that are close behind that with improving their vaccination rates. Next slide. The other concern that I hear most commonly is really about the safety of the vaccine. We know more than 135 million doses have been distributed in the United States. There are hundreds of published studies on safety, 20 plus years of ongoing study and monitoring. Serious reactions or long-term side effects are incredibly rare. The rate of anaphylaxis is less than 0.0003%. And the only contraindications are anaphylaxis to a prior dose of HPV vaccine or a history of immediate hypersensitivity to yeast. Next slide. I thought it might help to hear a little bit about our experience here at Levine Children's in Charlotte. As mentioned, we started intensifying our efforts back in 2020 with using the announcement approach and really dedicated to educating our physicians and APPs on how to use that. And we did see significant jumps. And then, of course, had a plateau after that. And so we started then educating on the importance of starting conversations at age 9. It takes 3 to 4 years to get that complete by 13 metric, but the thing that I found most interesting is even though we shouldn't have seen an uptick by starting conversations at age 9, within the year following, we actually did see a consistent uptick in our vaccination rates. And so there seemed to be something about educating our clinicians on this evidence-based strategy that reminded them or reinvigorated them to make sure that we were consistently messaging and getting those kids complete by age 13 as a almost side effect of implementing the conversation at age 9 strategy. We are currently in the midst across all of Advocate Health, our 6 states of service within primary care, pediatrics, and family medicine, doing a maintenance of certification project similar to what we did back in 2020. That ability to get maintenance of certification points from your specialty board has been a nice reward for doing the work as well. Education materials. We have a partnership with the American Cancer Society that has been amazing, and we're able to actually create some co-branded materials that are available to parents, but also just the quantity of education materials from respected American Cancer Society, HPV Roundtable, and others to be able to offer your physicians, APPs, your staff, and your patients even a variety or a menu of education materials, and giving people some choice in what you think will be most effective for your individual practice and circumstance. The other thing is, as pediatricians, we don't have a lot of insight into long-term outcomes with adults who are suffering from HPV related cancers. And so sharing survivor stories has been a helpful strategy. We do have a database that we have created that allows us to look not just at complete by 13, but at the 9 to 12-year-old age range. And if you have that capability within your EMR, it lets you see the results of your labor a little more quickly than waiting a few years for the completion. And finally, we are fortunate with our size and scope to have a really robust reporting and quality infrastructure. But even down to an individual practice level, if you're purposeful in how you do this, it's easy to have regular report outs and quality monitoring if you build it within your structure. Next slide. I'm a big fan of simplicity as much as possible. So keep it super simple is a way to think about this. Know your data and report it regularly. Competitive physicians and APPs are very data driven, and we want to win. So being able to improve our performance based on data is really an effective strategy. You want to identify those patients due for HPV vaccine, both at the time of visit and asynchronously. Share the importance of HPV vaccination using the announcement approach, starting the conversations at age 9, really emphasizing the role in cancer prevention and the safety data. And finally, Nurses are the most trusted healthcare professional role. And so using your staff to help reinforce the messaging and the importance is really a key strategy and should be part of education efforts as well. Next slide. I included here some resources that are helpful. Some of these resources also have toolkits available for people and practices. I'm going to put in a plug for the conversation guides through the Center for Unbiased Science and Health. Sometimes, as clinicians, we have trouble picturing what those conversations could be like. And those guides really do a great job of kind of almost scripting out the conversation and being able to picture what the conversation can look like. Next slide. So rolling this into a single message, HPV vaccination is cancer prevention. And if we can get this one point across to our physicians, our APPs, our staff, and our parents, that is going to go the longest way to improve our individual vaccination rates. And I believe we are at the end. So here's my contact information if you want to reach out.
Thank you so much, Dr. News, for this super informative presentation. Could we go ahead and go to the next slide? We are going to be transitioning over to our next presenters. But of course, if you have any lingering questions for Dr. News, still feel free to enter those into the chat. But next, I'd just like to welcome Ms. Samantha Wells, who is the Community Program Coordinator for the HPV Cancer Prevention Program at St. Jude Children's Hospital. We also have Ms. Julia Brown, who she'll be co-presenting with, the Community Program Manager, also with the HPV Cancer Prevention Program with St. Jude, on advancing HPV vaccination through provider education and other best practices. Again, if you have any questions for our presenters today, feel free to enter those into the Q&A box. And ladies, feel free to take it away.
Thank you so much. So good afternoon. Again, my name is Julia Brown. My colleague Samantha Wells and I are very glad to be here to share a little bit more with you about the work of the Start at Age 9 and other best practices implementation team of the HPV Vaccination Roundtable of the Southeast. Next slide, please. So here's just a quick glance at the topics we will discuss today. This won't mean much to you now, but it will be a helpful tool for you when you're reviewing the slides offline. But by the end of this, we hope that you will have a good understanding of the work that the implementation team has been doing and then also the resources that are available to you. Next slide, please. So before we talk about the implementations work specifically, I do want to share a little bit more information with you about the HPV Vaccination Roundtable of the Southeast, and you will hear this referred to throughout the presentation as the Southeast Roundtable. Next slide, please. So the Southeast Roundtable is a representation of people and partners across the 12 states and two jurisdictions that make up the Southeast United States. Coming together, we all agree on one thing. We want people to be vaccinated against HPV and have the protection that they need against HPV cancers. Next slide, please. So we know that in the Southeast United States, there are very specific conditions and contexts, and then also some challenges related to HPV vaccination and cancer prevention. But the good thing is that there are also so many opportunities for how we can improve HPV vaccination coverage, especially when we're all doing it together. So that's what we're going to be talking about over the course of the next few slides. Next slide, please. Before we get into that, if you have not yet joined us as a member of the Southeast Roundtable, we do invite you to do so. We would love to share with you more about our work overall and then the work of each of our primary priorities, and then also invite you to participate in the work of the Start at Age 9 and other best practices priority area. With that, next slide, I'm going to turn things over to my colleague Samantha so that she can tell you a little bit more about this work.
Thank you so much, Julia, for that introduction and that overview of the Southeast Roundtable. As mentioned, my name is Samantha Wells. I am the Community Program Coordinator with the St. Jude HPV Cancer Prevention Program. I also have the honor of serving as the co-lead of the HPV Vaccination Roundtable of the Southeast and the co-lead of the Start at Age 9 and Other Best Practices implementation team, along with Dr. Jennifer Irves. Next slide, please. So since 2024, our priority action implementation team has worked towards several different objectives to accelerate efforts to start HPV vaccination at age 9, involving different ways to best support the entire healthcare team to deliver that consistent HPV vaccination messaging and building that trust with patients through sharing some of the benefits and best practices, and also case studies that particularly relate to starting HPV vaccination at age 9. And as we are now looking ahead to the next steps for our team, we have began to shift a little bit our action items after meeting during our 2026 Southeast Roundtable in-person annual meeting to the 3 that you see on the screen here. So for our 2026 through 2028 priorities, we are looking forward to designing and conducting a regional environmental scan to identify, document, and analyze those current strategies to promote HPV vaccination at age 9. And we'll talk about that a little more in our next slide. And also strengthen the provider alignment system support for starting HPV vaccination at age 9. And finally, you can see working to identify some of those age 9 champions within the Southeast region to better help educate about those announcement approach training opportunities and links to other helpful resources. Next slide, please. So we are still in the initial phases of our environmental scan efforts, but we are so excited to share some of those next steps identified as we continue to plan this out. Next slide, please. So as I have just mentioned, there was recently a new objective added to the 2026-2028 priority action plan for our group, and that is to design and conduct a regional environmental scan to identify, document, and analyze current strategies to promote starting HPV vaccination at age 9. So after meeting amongst our implementation team, which we do meet monthly, some next steps for this particular effort have been identified as developing and finalizing a survey to distribute to the Southeast states and jurisdictions to really see what their current status is of revolving around starting at age 9 recommendations. And then this will then be compiled to gauge the gaps and opportunities that may be available to directly provide some of those resources and assistance. And also we will stop to consider as an implementation team, what questions would be the most effective to gain the best responses for this and essentially add to the overall scan. We also want to identify who on the implementation team is already or is considering creating a coalition within the Southeast states and jurisdictions, and actively working with them to help distribute the Southeast Roundtable information and resources that are combined or that are compiled. And lastly, a major goal of this particular objective, specifically for provider education, is to learn from states that are already implementing immunization registries and updates to better communicate to include age 9 specific resources and recommendations. So our intention here is to eventually be able to compile all of these lessons learned to serve as an additional resource for providers. Next slide, please. So now I do want to share about some of our healthcare provider specific opportunities and other professional training opportunities that we do have at the Southeast Roundtable. Next slide. So one of the primary trainings that we do support and offer assistance with as a resource, as Dr. Neuse did talk a lot about in her presentation, is the announcement approach training. And it's often referred to, or you'll hear it referred to as the AAT, which was initially developed at the University of North Carolina at Chapel Hill. And as mentioned by both Brianna and Dr. Neuse, we do recognize and emphasize that a strong recommendation from a healthcare provider titer specifically remains one of the most important predictors of someone's HPV vaccination status. The announcement approach training is a proven evidence-based intervention used to train providers to give strong and effective HPV vaccination recommendations and include the 3 steps of announce, connect, and counsel, and follow up and try again. So specifically from the 2025 to 2026 documentation of the HPV cancer prevention program. Both our program and internal programming has supported and provided guidance for about 11 AAT trainings and have helped to train over 126 providers and office staff within different capacities. Next slide, please. So here is an example of some of the AAT outcomes from a recent series of AAT trainings provided virtually, actually in collaboration with the ACS, in which there were close to 60 individuals trained over three trainings. So after collecting and reviewing some of the evaluation from both our pre and post-test surveys data, there was about an 83% increase in respondents who agreed with the statement of when discussing HPV vaccine, I feel confident addressing the parents' concerns. So that's always great to hear. And there was also a 174% increase in those respondents who strongly agreed with the statement, I know how to recommend HPV vaccination in a way that leads to the actual vaccination, leads to the patients or the families getting the vaccination for sure. And finally, there was about an 87% increase in those who agreed or strongly agreed with the statement, I plan to routinely recommend HPV vaccination when patients are between the ages of 9 and 12. So we can definitely begin to see where this is steadily making an impact in the overall confidence of providers and sharing that provider education. Next slide, please. So we definitely want to make sure that you are aware as a partner or anyone who is interested in hosting the announcement approach training for your clinic staff or any other group. You can always request support from the St. Jude HPV Cancer Prevention Program by just shooting us an email at preventhpv@stjude.org, and we would be happy to assist with any of those needs. We will actually work with you to become trained as an AAT facilitator or help to identify someone who best fits this role, which at that point you would gain the access to the evidence-based AAT materials and other facilitator resources that would be helpful. Some ongoing technical assistance with training logistics, as well as that continuing support before, during, and after the training to ensure overall successful implementation. So please definitely take the opportunity to utilize some of these free resources and this assistance and guidance as we work to get more providers and staffs trained in this area. Next slide, please. Now I will share a little bit more about our quarterly case study meetings initiative. Next slide, please. So these meetings are offered to anyone interested in learning about various efforts to begin implementing improving HPV vaccinations, and particularly starting this series at age 9. So each of these sessions highlight several case studies of the successful implementation of best practices, again, to starting the HPV vaccination at age 9. And this series was actually launched in September 25th, so we're approaching a year to help celebrate regional and national teams demonstrating that innovation and excellence in starting HPV vaccination at age 9 and other best practices. It has also now evolved to offer continuing education credits for our attendees. But this is also a great way to further support that provider education and on-time HPV vaccination. This slide here shows a picture during one of our quarterly case study meetings held this past January, highlighting the work of the Stop Cancer in Alabama, which was a really great session. So we are so thankful for these opportunities. And also, as we are preparing for 2027, if you know of anyone or know of a team that would be great to highlight within these meetings, please feel free to share with us, again, by emailing the preventhpv@stjude.org. Next slide, please. So also also, just briefly, throughout our quarterly case study meeting series so far, these are some overall key take-home messages that were highlighted and included for our participants. One is about increasing the EHR clinical decision support alerts, educational presentations, and messaging to parents, providers, and medical assistants have proved to be very, very helpful. Also, primary care providers could often have lower intentions to use some of these presumptive approach recommendations due to the overall perception that parents do not usually accept these vaccinations. So, but also another takeaway is just even that these opportunities for cancer prevention through effective collaboration, awareness, and systematic preventive strategies are very widely accessible and available. So we want to just let people know that this assistance and this guidance is out there. Next slide, please. All right, we also want to share a little bit about some more helpful resources within the next few slides here. Next slide. So we want to particularly highlight some educational materials that are made available through the It's Our Way Down South communication campaign, which was developed by our communication priority action team. And in regard to provider education, really sharing these various campaign materials can be shared within clinical settings or really any place that could provide that education to parents and families. On the bottom left here on the screen, you can see is an example of some of the materials being used at a health coalition meeting in El Dorado, Arkansas. And on the right there, you can see is an example of these materials being used in a doctor's office at Forsyth County Department of Health in North Carolina. Next slide, please. So there's lots of other materials available through the It's Our Way Down South campaign, particularly for healthcare providers and professionals. In particular, the badge buddies and pocket cards have been created and essentially can make it easier and more convenient for the provider to already have for that quick access while talking to and educating the parents and families. They are also directly aligned with the announcement approach training and reminding them to use that announce, connect, and counsel and revisit the ways to connect with those parents. And so here's an example of the front and back of how the pocket cards actually look. If anyone is interested in requesting these, which I do have that information on the next slide here. Next slide, please. All right, so the badge buddies and pocket cards, along with any of our other It's Our Way Down South campaign materials and resources, can be accessed by scanning the QR code here on the left. Providers can also request print materials to be shipped free of charge to offer in their clinic to patients by using the QR code on the right here. So please don't forget to take advantage of these resources again. Next slide, please. So this is also something that we are very excited about as an implementation team. You all today are actually the first to be able to access our newly released Southeast Roundtable Age 9 Information and Resources Guide. So this new resource tool available is designed for community partners to help highlight best practices, evidence-based resources, and quality improvement initiatives to support HPV vaccination beginning at age 9 for the best possible outcomes. And some of those highlights within the document will include some key actions for public health organizations to begin implementing some different community engagement strategies. Helpful case studies are also included, as well as a resource directory and so much more. So please feel free to scan the access code here on the screen to be the first to look at this new resource and utilize. Thank you so much. Next slide, please. All right, so another resource that we are excited about to offer is our call to action template. So actually, after creating a compilation of HPV provider letters that have been used throughout the Southeast region and other areas, some common messages found included were ways to encourage providers to begin the HPV vaccination at age 9, emphasizing that overall cancer prevention, HPV vaccination is cancer prevention, providing a strong recommendation, and just really using every clinical visit as an opportunity to vaccinate or to encourage to vaccinate. So using these findings, the Start at Age 9 and other best practices implementation team has developed an overall call to action template with suggested steps to create your own state-specific provider letter. These recommendations are intended to serve as really guidance and are again based on successful HPV provider letters that were previously shared by states and jurisdictions. So please feel free to scan the QR code on the screen here to access this template, and it will also be added to our webpage for the Southeast Roundtable. Next slide, please. So here are some key overall takeaways that we want to leave you with today from sharing our resources. The first thing is a strong provider recommendation definitely matters, as you've heard throughout this webinar today. That is a very significant part of increasing those rates. Starting at age 9 and really try to make every visit count, as I mentioned earlier. Also, evidence-based practices have shown that education is a much powerful tool when it's paired with additional implementation support. Take advantage of and utilize those evidence-based tools and those free resources that are readily available to you. And probably the most important thing is to share what works and specifically those lessons learned so we can all work to improve these efforts. Next slide, please. So thank you all again so much for listening to us speak today about our recent efforts, and please feel free to visit the HPV Vaccination Roundtable of the Southeast website at stjude.org. Yes, email us at stjude.org, preventhpv@stjude.org. So thank you all so much for listening to us today, and let us know if you have any questions. Thank you.
Thank you so much, Samantha, and thank you, Julia, as well. Next, we are going to be welcoming all of our presenters back. So following these really robust presentations, we're going to be entering this live Q&A time. So if you haven't already, please feel free to enter any questions that you may have into the Q&A box. And we'll welcome back Dr. Lynn Noose, our earlier presenter, alongside Ms. Samantha Wells and Julia Brown. All right. So we had a question that just came through, I think, Samantha, just following a lot this discussion that we've had in both presentations, honestly, about AAT training. Matthew Fong asks, how long are AAT sessions?
Yeah, so they can be held within 1 hour. So, but it is recommended to allow about an hour and 15 minutes for these sessions. So a lot of people do take advantage of maybe that lunch hour for the clinic staff. But yeah, it can be done in an hour, but recommended for about an hour and 15 minutes.
All right. Thank you for that. And definitely continue to enter any questions that you may have into the chat. We're going to go on to some other ones. So I know that both of you have been longtime partners with ACS. So whether you are implementing these efforts within your health system or supporting others who are doing this work, what strategies do you feel have been the most effective in trying to transition from vaccination improvement work based on a certain time frame to something that is a little bit more sustainable, transitioning from like a project to a sustainable standard of care with HPV vaccination?
I am happy to take a stab at
Yeah,
that
sure.
if you would like. So I think for us, we've made it part of what we do. So we report out on multiple quality metrics monthly. It is rolled into all of our levels of leadership. So the details shared at the highest level of leadership may look a little different than what's shared at the front lines. But it's part of how we do business at this point. I think that's how you keep sustaining. The risk of it is then you become complacent and you're only potentially looking at internal data and not looking externally to say, are we maintaining the same pace that we need to? And so that's, as I'm listening to Julia and Samantha, that would be a lesson I'm bringing back is make sure that we're not always looking inward, that we make sure that we're understanding what the larger population rates are and how we can continue to drive improvement.
Absolutely. Julia or Samantha, either of you would like to answer as well?
Yeah, so I was gonna say something really similar, so that gets us off to a great start. But I think the project is what makes it quality improvement, but the practice of it is what makes it sustainable. So the more you do it, the more routine it becomes, and then it at some point it is normal and it's a normal part of your practice. And then I think that's where the work that Samantha has been doing with the implementation team, Samantha and others on the implementation team have been doing to promote these best practices kind of really helps to support Dr. Noose's point that the information has to be getting to the clinics about what else is out there that can help
Right.
to constantly improve these processes.
Yeah. Well, thank you for helping be part of that work that's going on in the background. Samantha, anything you'd like to add?
No, I think Julia covered it all, but yeah, we definitely want to work to gauge of those other opportunities we can to educate providers and the public about these different ways for the HPV vaccination to be implemented.
Right. And Dr. Nish, you mentioned briefly in your response talking about the metrics and the different things that you all have been collecting. So I'd like to ask, like, what early metrics or indicators really show that a provider education intervention is working, see, before we actually get to the vaccination rate change?
That's a really great question. For us, being able to build our dashboard to look at ages 9, 10, 11, and not wait until 13 has been a game changer. Now I realize
Hmm.
that not everybody is able to do that or has the technologic capabilities. I mean, it was a huge endeavor, even with our resources. So I think there are other ways that you can do it. Just most of us either through state registries or through uh, uh, EMRs. Sorry, I don't know why I blanked on
It's
that.
okay.
Um,
It's
uh,
almost Friday.
and so, being able to pull your data through the capabilities that you have available to you can still give you an idea of how you're driving. So if you're able to pull from your immunization registry, the number of 10-year-olds or 9 and 10-year-olds who already have dose one of HPV vaccine. And you can watch that over time if you pull it on a regular basis. Depending on the size of your clinic, it may make more sense to pull it once a quarter if you're small, because you want to have your number enough people to be able to build your numbers and get a meaningful response. If you're 40 plus clinics, then it makes sense to be able to pull monthly because you're going to have enough of an end size to see that response.
Right.
But I think any way that you can get to those younger ages and start to see movement, you'll be able to at least draw some educated assumptions about what your complete by 13 is going to look like.
Gotcha. Thank you, Dr. News. Now, I did see in the Q&A box that a question did come through for our St. Jude peeps. So the print materials, so they are interested in the Southeast Roundtable print materials request, but located in California. They just want to confirm, can they still access these, or does a local roundtable have the same materials available?
That's a great question. We welcome you to access the resources and glean whatever you can from them, although that they are grounded in the context of the Southeast and those characteristics that are really important to Southerners like myself. But I think that they certainly can be adapted and used in other ways on the West Coast. I'm less familiar with resources that are available in that area, but I don't know, Samantha, do you know of any that can be used?
Yeah, and
Not immediately, but I can definitely we can definitely follow up about that for sure. but yeah, anyone can request those materials. But like Julia was saying, some of those southern taglines may not apply. But we also offer a chance for co-branding for some of these materials. So yeah, just shoot us an email, like I said, and we can work something out particularly for you.
Thank you. And it looks like Heather Brandt also kind of second that same message that a lot of those messages were created for the Southeast, but can definitely be adapted for other areas. So definitely feel free to reach out to them for further collaboration. Another question came through. Let's see. They asked, can USVI join the Southeast Roundtable? I'm not sure what that stands for off the top of my head.
U.S.
But
Virgin Islands.
U.S. Virgin Islands, there. Okay, it's almost
Just
Friday.
check
That's the
out the
last time I'm gonna
background.
use that excuse. I'm like, okay, I know I'm missing something here. Okay, yeah. So can the U.S. Virgin Islands join the Southeast Roundtable? Looks like there's a lot of traction coming in for you guys.
Yeah, we've had some discussions about this to date, and we'd love to continue talking about it. So if you don't mind, send us an email at preventhpv@stjude.org so we can connect with you offline.
Okay. Thank you so much for that. I know we are super short on time, so we will actually have to transition over to our closing, but I do appreciate everyone who has interacted with our great presenters today in the Q&A box and any praise that's come through. There's also been a request for you, Dr. News, just of some further collaboration and getting more details on some of the things that were shared in your presentation. So I'll be sure to pass that along to you. But thank each of you for being a part of this amazing session today and sharing all the tips that you have for provider education. Next, we will go ahead and move over to our closing. All right, thank you for bringing those slides back up. So I'll just be closing us out with some next steps, resources, and other educational opportunities. But first, we're going to start with that post-session poll that I told you about in the beginning. So please tell us, following today's session, which statement about the timing of routine HPV vaccination is correct. Now, I know most of you got this right in the beginning, so I'm sure you're going to get it right this time around as well. But also let us know which strategy or strategies, if any, you are most likely to implement in your practice or professional role to support provider education based on all the great things that you've heard today. Let us know on the poll. I'll give you a few minutes to do that. All right, looks like we're only at about 38%, and I know we can do better than that. But thank you all for thank you to everyone who has already answered and responded to that poll so far. I will give those who haven't a chance to continue to respond, and we'll move over to our next slides. All right, so as we wrap up the call, there are again just a few resources that I would like to call out to your attention related to today's content. So the ACS National HPV Vaccination Roundtable Best Practice Task Group, try saying that 5 times fast, has developed a series of brief, easy to read summaries highlighting what's known, what's new, and what's next for key topics related to HPV. So I have pulled out a few of those that I found to be really relevant to our conversation around communication strategies for providers and increasing HPV vaccination. So go ahead and follow those links to explore those evidence summaries. Next slide. Now, ACS and the HPV Vaccination Roundtable has also produced an on-demand provider education series in a range of topics to equip our providers with the latest information, HPV vaccination guidelines, science, and implementation strategies to increase vaccination rates. Please feel free to check this free series out. Next slide. Now, the North Dakota State University Center for Immunization Research and Education, in partnership with Sanford Health, also developed 5 free 1 hour self-paced modules in this learning program you see on the slide. So participants may complete the modules in any order with the option to earn free CME credit or a certificate of completion. Definitely feel free to check that out. Next slide. Now, both presentations you've heard highlighted the announcement approach as an effective way to recommend the HPV vaccine and help with addressing concerns. So, for additional support, check out the HPV IQ's announcement approach resource. It is a really practical tool for helping introduce the HPV vaccine, responding to hesitancy, and just overall normalizing vaccination as a routine standard of care. Next slide. Now, if you are interested in building your HPV vaccine communication skills, Humana, with support from ACS and St. Jude, is offering 3 upcoming announcement approach trainings this fall. So September 9th, October 6th, and November 12th. Definitely consider joining one of these sessions to learn more by following the QR code or the link in the chat to register. Next slide. ACS's HPV Vaccination Communications Toolkit may also be helpful for those of you who are seeking some outreach tools, including for health plans communicating with health systems, providers and members, and health systems and providers supporting HPV vaccination efforts. Next slide. Now, lastly, remember anyone can be a trusted messenger, even you. So whether you're looking to strengthen your vaccine conversations or find effective ways to address hesitancy, these resources can also be super helpful to support your efforts. Now, I know we only have like a minute left and there's a few slides left, but I'll try to run through those as fast as I can. For those of you who are able to hang on with me, I would really appreciate it. Next slide. Now, for those of you who may be newer to promising practices, this program is part of the ACS Accelerating Research to Care, or ARC, network with knowledge translation. The ARC network's webpage serves as a central resource for a variety of programs, including a dedicated section for promising practices. And that is where you will find all series related content. So we really encourage you to visit the webpage to access the recordings, the slide decks, resources, and other promising practices materials. In particular, the series recording and slide decks link, this is going to take you to the learning materials library that you may have seen dropped into the chat. So following today's session, all recordings, slide decks, and related resources will be posted there. And a follow-up email will be sent once the content is available. So if you do not see our communications in your inbox, please be sure to check your promotions folder. It's been brought to our attention that some email providers are kind of filtering those messages and things, and they're ending up in that folder. But of course, if you have any questions or have any trouble accessing that material, please contact us at implementationscience@cancer.org. Next slide. Now, I would like to invite you, your colleagues, your network to register for our next few sessions as we dive deeper into some topics surrounding HPV vaccination. And of course, that surprise session at the end on cervical cancer elimination this December. So our next session, session 5, is going to be held on October 15th. From 2 to 3 Eastern, discussing provider and team champions. So just building on some of the conversations from today, and we really hope to see you there. Next slide. And I'd like to leave you with just a few action items as you continue your HPV prevention efforts. If you work within a health system, definitely take the time to assess your current state, as Dr. News recommended earlier, just to identify your current practices and identify other opportunities for provider education to be implemented. Consider other partners and resources like St. Jude who may be available to help support your work. Both within and outside your organization can be options. And finally, of course, be sure to register for session 5. Next slide. Now, thank you so much for joining us for session 4 of the 2026 Promising Practices series. We truly appreciate each of you for your engagement and really look forward to seeing you soon.